Welcome to this explainer. I am so pumped to have you here today because we're tackling a genuinely fascinating biological puzzle. We're going to do a straight-up, head-to-head pharmacological breakdown of the only two FDA-approved hair loss medications in the world, Finasteride and Minoxidil. We're going to completely strip away the myths, look directly at the hard clinical data, and really build your understanding of these compounds from the ground up.
But hey, before we get into the actual mechanisms, I want to clearly state our baseline here. The information we're covering in this explainer is strictly for educational purposes. We're here to build your foundational scientific knowledge, not to prescribe treatments or give medical advice. Individual responses to medications always vary, so any real-world treatment decision should absolutely be made in consultation with a qualified healthcare professional.
Okay, let's map out the scientific journey we're taking today. We'll start with the underlying hair loss science, move into how these treatments actually work, look at efficacy and timelines, compare their specific strengths, explore combination therapy, and wrap up with safety and side effects. All right, part one, understanding hair loss science. Because to understand the cure, we first have to understand the biological enemy of hair preservation.
You probably know the clinical term for male pattern baldness is androgenetic alopecia. Basically, it's a progressive condition that involves this really complex interplay between your genetics and your hormones. Specifically, it's driven by a genetic sensitivity to a hormone called dihydrotestosterone, or DHT. In susceptible guys, DHT binds to the hair follicles and triggers a process called follicular miniaturization. It's exactly what it sounds like. The follicle physically shrinks over time, producing thinner, shorter hairs until eventually it just stops producing hair altogether. And get this, it is incredibly common. We're talking roughly 50% of men over the age of 50 dealing with this. But since it's a progressive disease, time is literally of the essence here. Early intervention is absolutely key, because once those follicles severely miniaturize, they might not respond to pharmacological intervention anymore. You really have to save the follicle before it's entirely gone. Moving right along to part two, how the treatments work. Let's look at the distinct biological mechanisms designed to stop this shrinking process.
Think of these two treatments as playing entirely different games. It's literally defense versus offense. Finasteride acts as this systemic hormonal shield. It plays pure defense against the hormone causing the damage by blocking the production of DHT. Minoxidil, on the other hand, is like a targeted biological engine. It doesn't care about DHT at all. Instead, it plays offense by stimulating blood flow directly at the follicular level.
Now, what's really fascinating is the exact mechanism of that biological shield. Finasteride acts as a competitive inhibitor of something called the 5-alpha reductase enzyme, specifically the type 2 isoform that hangs out in hair follicles. This is the exact enzyme responsible for converting normal testosterone into that follicle-shrinking DHT. By inhibiting this enzyme, just a tiny 1 milligram daily oral dose of finasteride drops DHT levels in the scalp by a massive 60 to 70%. It essentially just starves the baldness process of its primary fuel.
On the flip side, minoxidil's mechanism is equally wild. When you apply it, it actually relies on an enzyme in your own scalp called sulfotransferase to convert it into its active form. Once it's active, it functions as a potassium channel opener, which leads to vasodilation, or the widening of your blood vessels. It effectively fertilizes the follicle with oxygen and nutrients, and completely extends the growth phase of the hair cycle. Okay, part three, efficacy and treatment timelines. We know the science of how they work, but what actually happens out in the real world? The data we have is honestly pretty striking. In pivotal clinical trials for finasteride, right around 80 to 90% of men successfully halted their hair loss within 12 months. And beyond just stopping the loss, 65 to 70% of men actually showed some degree of visible hair regrowth. It is highly effective at stopping the progressive nature of the disease. But look, patience is absolutely mandatory here. Around the 8-week mark, you might actually experience a counterintuitive surprise: shedding. I know it sounds scary, but it's actually a good sign, especially with minoxidil, because those miniaturized older hairs are just being pushed out to make way for new, healthier growth. By 4 months, you start seeing fine regrowth. By 6 months, visible thickening. And the true peak clinical results, those don't land until a full 12 months of consistent use. This definitely isn't an overnight fix. It's a massive, long-term biological shift.
On to part four, comparing treatment strengths. With those timelines established, let's evaluate when and why each specific treatment really shines.
Because finasteride works systemically, it provides this comprehensive, sweeping protection across the scalp. That makes it incredibly strong at halting early to moderate disease progression, particularly in the crown area. Minoxidil, being a topical application, is amazing for targeted zones. It really excels in younger guys with recent, smaller areas of hair loss, and it works wonderfully to improve the actual caliber, texture, and thickness of the hair shafts right in those specific spots.
Which brings us to part 5, the power of combination. What exactly happens when you put the hormonal shield and the biological engine together?
Well, you get this incredibly powerful synergistic effect. It's a total classic case of 1 + 1 = 3, because they operate on entirely different mechanisms, one blocking the hormonal attack, the other boosting nutritional blood flow. Combining them yields vastly superior clinical outcomes. The clinical evidence shows roughly 20 to 25% greater hair count improvements when utilizing dual therapy compared to just using either medication on its own. Patient satisfaction rates just completely soar when these two are combined.
And honestly, modern advancements have made pulling this off so practical. Today, there are topical foams that combine both compounds into a single, easy step. It's remarkably simple. You dispense the foam, apply it twice daily to a dry scalp, and wash your hands. Done. This foam formulation completely beats the old liquid versions because it dries fast, it doesn't drip down your forehead, and it's way less likely to irritate your scalp. Crucially, using topical finasteride limits systemic exposure while vastly increasing the likelihood that you'll actually stick to the daily routine.
Finally, Part 6, Safety and Side Effects. We absolutely must transition to a neutral, evidence-based look at the potential drawbacks of both these medications.
Looking directly at the clinical trial data for oral finasteride, the primary concerns usually revolve around sexual side effects. Instances of decreased libido occurred in 1.8% of users, erectile dysfunction in 1.3%, and ejaculation disorders in 1.2%. It's important to note that these effects are generally reversible upon discontinuation of the drug. Also, healthy men should be aware that finasteride artificially lowers PSA, that's prostate-specific antigen levels, by about 50%. So that's definitely something you must disclose to a doctor during routine prostate screenings.
Now, minoxidil's side effect profile looks quite a bit different, mainly because it bypasses the systemic hormonal system almost entirely. The drawbacks here are mostly local and dermatological. About 5 to 10% of users experience scalp irritation, itching, or dryness. Some of the older liquid formulations contain propylene glycol, which can cause contact dermatitis, though the newer foam versions often bypass this issue entirely. Overall, systemic absorption is super minimal. And it's worth noting for both finasteride and minoxidil, the clinical discontinuation rates due to adverse effects remain incredibly low, sitting at under 5%.
So, that brings us to the ultimate question. What happens if you decide to stop? Well, you remove the biological shield and you turn off the engine. If you discontinue these medications, the underlying genetic process just resumes, and you will lose the hair you've maintained or regrown within about 6 to 12 months. That leaves you with something really important to consider. Are you ready to make a lifelong commitment to this science? It is a fascinating biological reality, and armed with this data, you now understand exactly how the modern science of hair preservation actually works. Thank you so much for learning with me today.